Bridget Murrow, a nurse practitioner with LeBauer Healthcare at Summerfield Village, is here talking about the importance of annual wellness visits. All right, so we've talked about how important they are. Let's talk about what happens, because maybe, things have changed over the last few years if we've been missing our appointments. What's included in an annual wellness visit?
Right. And normally I'm really hoping not a lot to update on your medical history front, but in case anything's gone on, we need to make sure your chart's updated. In case any family medical history has arisen that may impact your health, we want to update that, update immunizations, and of course a head-to-toe physical exam and some of that routine blood work that everybody enjoys so much.
Like cholesterol and things of that nature.
Of course. Yep.
Of course.
Cholesterol, thyroid, check, blood counts, a little bit of everything.
A little bit of everything. All right. So what about this? Because a lot of women go to their OBGYN for their yearly appointment and they use that as their annual wellness visit. Do they need to really schedule both visits?
It's definitely recommended that you maintain care with a primary care provider, and certainly for women who want to maintain the care with the OBGYN, I think that's very important. One does not supersede the other. But of course, the OBGYN is going to be more focused on the women's health aspects. Meanwhile, primary care is going to care more about things like your blood pressure and your cholesterol and some of the things that kind of fall out of the scope of that women's health specialty.
Okay, so when we talk about the annual wellness checks, we talked about that for adults. What about for children? How does that differentiate?
Very important for children. And oftentimes for children, we're looking into things like immunizations, making sure the kiddos are safe to go out to school or summer camp, making sure they're fit to play in sports, and of course, looking at some of those developmental milestones, just making sure that kids are growing up healthy and strong.
And is a sports physical the same thing as a wellness visit?
Oftentimes there's enough overlap we can get away with it, but particularly for some of those high school athletes participating at a higher level, we want to have a dedicated sports physical to make sure that their heart's strong and make sure their joints are healthy.
Okay. And for a long time, people were having a hard time finding a primary care provider, right? So if someone doesn't have a primary care provider, then where would they go for an annual wellness visit?
I've got a very easy answer for you there, conehealth.com/appointments. You'll be able to be connected with all of our available primary care providers who are taking new patients, myself included, and be able to even book online for a lot of our providers. It's as simple as that.
Okay, that's good to know, because for a while there you would call and try and get an appointment. They'd be like, everybody's booked and nobody's taking new patients, so this is a good news. All right, if you have a primary care provider, but you haven't been in a few years, should you start and with a call to them or start something new?
Yeah, give the office a call, see about making an appointment when you can. Oftentimes, unfortunately, we stay busy in primary care and these physical exams book out a couple of weeks, maybe even a month or two. And so there's no time like the present to give that office a call and get in to see your primary care provider.
All right, I've become a real fan of telehealth. So can the annual wellness visits be done virtually?
So for our Medicare patients, the annual wellness visit still is being accepted as a virtual visit. I think this is very important as we've talked about the spread of COVID, and it still has a presence in our community even after these few years have gone by. These Medicare patients can be seen virtually for that annual wellness visit. However, for most folks, we want you back in the office for a hands-on physical. There's unfortunately no way that I can listen to your heart through the screen. There's no way that I can get blood work from afar.
All right, and what about like the cost of a wellness check? Does something determine it more than something else?
So typically for these preventative visits, insurance really likes to see these done. These are typically visits that are covered by insurance. Of course, your individual plan may vary, but typically, insurance's logic is that if we can do everything we can to keep you from getting sick, well, hey, they're happy to cover those visits.
Okay, now what about, does your annual visit, I'm sure that you're going to tell me, it doesn't take the place of like things like mammograms or colonoscopies or things of that nature?
No, it certainly doesn't. And of course, here in a primary care office, we have limits on what we can do. But I always tell my patients, it's not your job to worry about when you do for your next mammogram. When's your next pap smear due? When was your last colonoscopy? That's my job to worry about that. And if you make sure you're coming to see me on a regular basis, I can make sure that we're looking out for your health.
And schedule all those screenings that we need to have.
Exactly. We get all of that coordinated. And usually I tell my patients, all you got to do is just answer the call and schedule when the office calls.
Yeah, and that My Chart is fantastic. Makes it so
oh my
easy.
goodness, it's great. It's great.
All right, thank you so much for your time and your expertise. Folks at home, if you missed any of today's segment, just head over to our website, click in the To Your Wellbeing section.